There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Bukowski. Today we're talking all things safety and many of the different programs and facets of our work here at the Department of Children and Families that support children being safe not only in their homes but also in their communities. As part of our mission statement, we are looking for all New Jersey residents to be safe, healthy, and connected. So this really ties into the core functions of what we do here at the Department of Children and Families. Joining me are two guests who will be talking about the different programs that they work with. There's a lot of different programs that you work with. So I'll turn it over to you to introduce yourselves, and then we'll get to the conversation.
Sure. I'm Greta Anderson. I am the Assistant Commissioner that oversees the Office of Youth Residential Licensing, the Institutional Abuse Investigations Unit, as well as the Office of Conflict Investigations.
And I'm Nydia Managas. I am the Director of Training and Statewide Initiatives with the New Jersey Children's Alliance and also Assistant Teaching Professor at Montclair State University in the Department of Social Work and Child Advocacy.
And you're both also co-chairs of the Safety Subcommittee on the task force.
Correct.
Yes.
So welcome to DCF on the Air.
Thank you.
Thank you.
I think we're going to start off with you have so many different roles. But we're going to start off with your role on the task force and chairing that subcommittee on safety. I'm wondering if you can talk a little bit about, I know recently the task force has undergone sort of a pivot or a strategic redesign of what it does. And part of that was redesigning what had previously been the Protection Committee is now the Safety Subcommittee of the task force. I'm wondering if you can talk a little bit about that and maybe also define for our audience what you mean by safety.
Sure. So the Safety of Children Subcommittee came to be, as you said, when there was a restructuring of kind of looking at the different subcommittees that fall under the New Jersey Task Force, to kind of look at our child serving systems that work with our children to keep our kids safe. So really our mission statement for the Safety of Children Subcommittee is to make recommendations ultimately to those child serving systems and come together and respond to and look at ways to improve those systems that take care of our kids.
Yeah. And when you say the child serving systems, I think that kind of goes into what we view as, the child serving or child welfare system in New Jersey is not just the Department of Children and Families, that it's much broader than that. Correct.
That would include schools, daycare centers, juvenile detention centers, group homes, and residential centers as well.
Okay, great. So turning to some of the other roles that you have, and you both have so many, but thinking about the IAIU in particular, I know that for the providers that work with IAIU, it's common. Like we know what this is. We work with them every day, but not everyone does. So I'm wondering if you can talk a little bit about what IAIU is, and then we can talk a little bit about what jurisdiction it has.
Sure. So as you know, DCF has a lot of acronyms, correct, that fall under the umbrella. So one of them is IAIU. It stands for Institutional Abuse Investigations Unit. And I think to understand the IAIU in the right context is to know where it actually sits in the agency. So the IAIU is a sister division to our Child Protection and Permanency Unit office. And the same mandate holds true for both. The difference is to investigate allegations of child abuse and neglect. When it comes to the difference with IAIU, we investigate allegations of child abuse and neglect in out-of-home settings. And those settings can range from, as I said earlier, schools, bus companies, childcare centers, juvenile detention centers, just to name a few, and group home and residential centers. And one of the key focuses of IAIU is to obtain facts on those allegations that have come in, wherever those allegations are stemming from. And they do that a number of ways. The investigative process, I think, is important to understand as well. So they respond to the intake or the allegation. They interview individuals that are involved in an investigation, and that's the alleged child victim, any involved caregivers, and other relevant parties to that. They then review records. They review possible history. They review medical records if there's medical records that have come in on an investigation. They also work with law enforcement, so they may review police reports and things like that, even IEPs if it comes to a school case. So then they distribute the report. So the report is completed, and then all appropriate and relevant parties receive that findings report of what our findings are. And I think it's really important to note that one of the key pieces of an IAIU investigation is not just to address the immediate incident. It's also to look at where we can be proactive in one of these child-serving systems to ensure that we reduce the potential of future maltreatment in those settings.
Yeah. Now, I think one of the, I know this is a misunderstanding with Child Protection and Permanency, the division that handles in-home caregiver allegations of abuse and neglect. But IAIU is not a prosecutorial agency, right? It's not
Correct.
It doesn't prosecute criminal offenses. So what are some of the tools that IAIU has at its disposal to ensure that safety is met? And how do you work with law enforcement?
So I think one of the tools is working with our external stakeholders. I think that's extremely important when it comes to, especially, there are programs that we investigate where we do not regulate, where DCF does not regulate. And when it comes to those environments, we really rely on those other external partners, law enforcement, our RDTC, Regional Diagnostic Treatment Centers that do medical evaluations on our children who have been abused, especially who have been sexually abused. So with law enforcement, each law enforcement agency, each prosecutor in the 21 counties in New Jersey runs a monthly MDT meeting. At that table is CPMP workers who may be involved with a case that's being discussed. We have medical professionals that are at the table. Local law enforcement are at the table. So child advocacy representatives are at that table. And I think what has helped for institutional abuse to be at that table as well is to not only build partnerships with those other stakeholders, it also helps when when a case is being investigated, investigation on something that also has a criminal component to it on their side, to get updates on that and to see where the status of that investigation is.
Sure. Now, I know we're only about a week and we're talking about the different roles that you both have. And Greta, congratulations on your new role as Assistant Commissioner.
Thank you.
But I know that we've recently kind of reorganized a little bit around institutional abuse, coordinating it with our Office of Licensing, coordinating it with our conflicts unit. Mm-hmm. I'm wondering if you can talk a little bit about what that new vision is for institutional abuse in the context of its partnerships with licensing and the conflicts unit.
Sure, absolutely. So I think, the role of IAIU isn't really shifting per se. However, I'm just here to build on the amazing work that the Institutional Abuse Investigations Unit and Youth Residential Licensing teams have done to ensure our kids that are in care are receiving what they need. I look at this time as a great opportunity to work with our other internal offices and divisions that have impact on our youth in care, in congregate care specifically. So I'm specifying like DCF regulated programs. And I think it's the right time to build a more robust communication protocol when we're working with Children's System of Care, our Office of Monitoring, our contracting office, our institutional abuse, youth residential licensing, just so we can streamline that process and communicate even more when it comes to our youth in care. So when we do work with our providers, especially our DCF providers that house our children, that we are coming from one voice, one DCF. And I think it makes sense to create a more robust communication protocol to support those youth and to support the providers, that we're keeping our youth safe, and at the same time, we're supporting the providers that care for them.
I know that in some of our meetings with the task force, and Nydia, feel free to jump in on this too, because I think this speaks to some of the conversations that we've already had previously. But I know that one thing that we're seeing sort of post-COVID is that we're getting a higher number of referrals for institutional abuse. So we're getting more calls in to investigate these settings. I'm wondering if you can speak a little bit to that. Like, what are we seeing right now, and how are we responding to that?
Well, I could tell you from the IA perspective that the data does tell us a lot. Some of the data says that, so the IAIU investigates the top 3 facilities that are investigated. Our schools, that is the majority of the investigations the IAIU investigates. Then you have child care centers, and then third would be congregate care or group home residential centers. When it comes to the schools, you are correct. There has been a spike in allegations of child sexual abuse in school settings. It's in the newspaper. It's not really a secret. This is what's happening. And it really is looking at, is there a spike? And it could be twofold. Is there a spike because more people know to report allegations of child abuse and neglect, which can lend itself to increase in intakes? And also, and one of the concerning parts of that is that the rate of substantiation of child sexual abuse in schools is on the rise. And that's the most concerning part when it comes to our schools. When it comes to child care centers, we're really trying to do a deeper dive into those centers and into those investigations to see what is going on, what that landscape looks like. However, we do have a safety net because we have our child care licensing team that wants to care for our kids and keep those child care centers safe. So they're out there at those centers. So we have another pair of eyes because we have that in place. And when it comes to our congregate care settings, especially group homes and residential centers, like I said before, I think it just is important to build that robust communication internally, because then that will just extend out to our providers. And so they kind of know where they need support, but also where we need our kids to be safe.
Yeah. So I guess in one hand, we're seeing more substantiations of allegations, which is not a good thing. But I think we're also seeing more reporting, which I think we can say is we're removing some of that stigma where people can come forward and get the help that they need in order to get those bad actors out of the classroom, out of the child care center. So in that sense, I guess there is a silver lining here, right?
Correct. You always have to be hopeful.
Yeah.
Right? You always have to be hopeful.
I try.
Yeah, and so the subcommittee on the safety of children is looking to address those concerns. How can we make these child-serving institutions safe for children so that they can thrive and so that they're protected and we can really support their growth and development? And so we have 2 work groups that have developed out of that subcommittee that are looking at 2 different angles of this. And so one of them is training and education, which I'll let Greta talk about, but we also have the policy and legislation work group that is really aiming to look at what we call pass the trash legislation, which is legislation meant to protect children who are in these child-serving institutions, primarily schools. And so they really require schools primarily to do background checks of prospective employees, but then also to reach out to other schools and for schools to share information about any allegations or findings of abuse and or sexual misconduct in schools. And so in New Jersey in 2018, we had pass the trash legislation passed. And so in 2024, the New Jersey State Commission released a report that found many loopholes in that legislation. And so what they were finding was that, there was no centralization of this process, there's no standardization, and there were too many ways in which prospective employers and employees could really just circumvent the system that's required to protect kids. And so we currently have 2 pieces of legislation that have been introduced to remedy those loopholes in the existing legislation. And so the policy and legislation work group is looking to make some recommendations around improving existing legislation and, support existing legislation.
Yeah. And I think that goes to what the strength of the task force and its subcommittees are. I know from a departmental standpoint, we're part of the executive branch. And, we can't really put out recommendations around legislation ourselves. We're really about how do we execute on the legislation that's passed. We monitor legislation that's moving through the process, but we don't really publicly speak about like whether we want this bill to move versus that bill. But I think that's one of the areas where the task force can do some advocacy that I don't think the departments can. And I think part of that is also bringing together stakeholders, bringing together folks from the community that can look at these things, with DCF kind of side by side, look at the data and make some recommendations. So where do we stand right now on that legislation and kind of advancing that advocacy?
So it's been introduced in both houses to date, and so now we're at the point where we're looking to meet with those legislators to talk about what their recommendations are, what we think is going to improve the existing legislation, and then sort of jump behind one of those pieces of legislation. Generally, the both pieces of legislation are looking to centralize the process, standardize the forms that are being used, create databases for historical information, there's a 20-year limit right now on history, and so eliminate that limit, have an auditing process in place to make sure that districts are doing what they're supposed to be doing, create some time frames around responses from school systems when they're asked about prospective employees who are looking at other school districts. In the past, what has happened is called pass the trash because a teacher, for example, might engage in some sexual misconduct or abuse in a school. They would do a do not disclose a DNA agreement, sort of remove those records, and then they would jump to another school district and then continue that behavior in other school districts. And so we were not protecting kids in other school districts. That school district perhaps, didn't have to worry about that teacher with those children, but other districts were dealing with the same issue. And so they called it pass the trash, and it's a national label. And despite our efforts in 2018 with the existing legislation, there were too many loopholes. And so the current two pieces of legislation that have been introduced are looking to remedy those loopholes.
Sure. And I think it's about, drawing those boundaries between, being a supportive individual in someone's life, being able to step up and go that extra mile, because those teachers are a godsend.
Yeah.
But also making sure that this is a very bright line. Like I'm willing to support a child, but I have to make sure that I'm being careful about not crossing their boundaries.
Right.
And I think that's where the Training and Education Committee work group comes in. It's helping teachers to understand where those bright lines are. Yeah. I think like you both said, back in the day it was like that creepy teacher, that creepy coach. We don't want to allow for that anymore. We're not going to accept that creepy teacher or that creepy coach. Like, what are the signs that we're looking for that are unacceptable, that teachers can say, I know we're cool and I like you as a colleague, but, the rule book says these 3 things are not good and I have to report them, and so I have to report this, right? So empowering them, providing them with some guidelines to be able to feel confident and safe in reporting when they see things, because they're seeing these things. Other kids are seeing these things, the other adults are seeing these things, but they just don't know, when it's sort of that creepy behavior that we're like, oh, we'll just stay away, when we should be making a report. And so if we have some clear guidelines saying, when you see these things, you say something, then they're going to feel more empowered to do that. And that trusted adult that kid is coming to now can also, help that child, as opposed to that child going to that adult and that adult not knowing what to do with that information, letting that kid down, and that kid then never tells anyone again. And then the other adult continues to harm children. And so I think that's, we're doing some really important work with Training and Education Committee, is trying to figure out how we can best collaborate with schools to create those expectations.
I think that's fantastic. And that we're creating an environment that is empowering not only to students, but also to fellow teachers to really elevate the best of the practice, elevate the best of the profession. So I think that's fantastic. Yeah. Hopping around on hats. because there are just so many hats here. Nidhi, I'd like to talk a little bit. We talked about allegations of sexual abuse in schools. And I think, part of the work that Greta's looking at is really how do we keep kids safe in the community. But another aspect of safety is how do we keep kids safe in the home when it's not allegations against a caregiver, but maybe it's a child-on-child situation. So I know in addition to all the other things that you do, you also co-chair the Problematic Sexual Behavior in Children Committee that's looking at how do we support when there's been these instances of a child actor, it's a improper conduct between two children. Can you talk a little bit about what that is and what we're doing in New Jersey?
Yeah, absolutely. And so first to define what we're referring to as problematic sexual behaviors in children. So we'll say PSB just for short periodically. So PSBs are behaviors initiated by a minor, someone under the age of 18, that involves sexual body parts and that is developmentally inappropriate and harmful to that individual and or the person or child or children who are being impacted by that sexualized behaviors. And so in around 2021 or so, we sort of recognized that we didn't really have a statewide response to responding to these kinds of cases. So when a call came into the hotline, if there were concerns about abuse and neglect on the part of the caregiver, then it might be opened and it would, either for a child welfare assessment or for child protective services, and that child and family would get supports and help not only for alleged abusive and neglectful behavior, but also to deal with those kinds of concerning behaviors. But when those cases are screened out, which oftentimes they are because the caregiver is not deemed to be abusive or neglectful, right? This is a child initiating something with another child, and parents are responding appropriately, but now they just don't, aren't sure how to handle it. Those cases we were concerned about because they were not getting access to services, right? They'd be screened out, perhaps, given some resources, whoever the caller was, because keep in mind too that it's not parents calling the hotline, right? Most of these calls are coming from, educators, law enforcement, hospital, mental health or medical staff. And so the parents aren't calling themselves asking for help. And so these callers are given information of, give this to the caregiver, have them call, X, Y, or Z. But how often we don't know that this is actually happening. And so these kids potentially might be going on to harm themselves or harm others. And we know that treatment really works. And so we wanted to make sure that these kids had access to treatment and that the kids impacted, right, the child, the victim in these cases, which we don't use that language, but just to kind of set the foundation for you all. So we'll talk about the impacted child as a victim in these cases. Sure. So that impacted child also wouldn't be getting the help that they needed, presumably, right? And so we said we need to figure out a way to ensure that these cases that get screened out also get access to these specialized services that we know that they need to prevent any future harm and just get them on the trajectory to thriving and growing and developing well. Yeah. And so we created a work group. So Commissioner Christine Norwood-Beyer and I identified some folks who we thought should be at the table to have this conversation about how can we develop a statewide response to these issues that doesn't require law enforcement or CPS getting involved necessarily, right? We didn't want that. We didn't want kids being charged. We didn't want CPS investigations happening if the parents are not abusive and or neglectful. And so we identified, a bunch of people that included various departments within divisions of the Department of Children and Families, including the Children's System of Care, of course, our Child Abuse Hotline, the State Central Registry. We had folks, of course, from Child Protection and Permanency. In addition, we had care management organizations present at the table. We had all of our multidisciplinary team partners, law enforcement, prosecution, mental health, medical health, our victim advocates, other child advocacy center staff, the New Jersey Children's Alliance, representation from the task force was also present. And so we all got together to kind of figure out how can we ensure that all kids have access to specialized services when there are concerns of problematic sexual behavior. We collected lots of data, early on to see, we looked at our 21 counties and surveyed them and asked, what are you doing with these cases when they come to you? How are you handling them? What are the resources available in your community? We sent surveys to some caregivers to see what their response was and how they navigated the systems that were meant to help them. We also met every 4 to 6 weeks. So we had, 30 plus people who regularly attended these meetings and got input from all the partners about what they're seeing, what they hope will happen, how do they think we should be addressing this issue. We also spoke to other states to see how they were navigating these problems when they come to their door and how they were accessing funding to pay for these services, right? Because if we're talking about kids outside the system, we want to make sure that they're accessing services at no cost to them as well. And so we collected lots of data, met for over a year, and developed what we call the framework, a statewide response to problematic sexual behaviors. That was probably released in early 2023. And then we implemented the actual referral process in 2024. And so we created a brand new system where there's no precedent, not in New Jersey, but nowhere in the country. And so we started something brand new and have been really navigating and pivoting as needed. When we created this framework, we identified four areas that needed to be addressed. One was the referral piece, right? When this call comes into the hotline, where are they getting sent if they are not being screened in due to concerns of abuse and or neglect? And so we not only was a new unit or a team created within the state central registry, the child abuse hotline, that specifically assesses these cases. We also created new positions throughout the state out of our care management organizations called specialized care coordinators. So when this case comes into the hotline, the specialized team at the child abuse hotline assesses this case, screens it out. Then they're not just giving the referent information to give to a caregiver. They're sending those referrals to law enforcement and to the specialized care coordinators concurrently. So now there's an actual person who is responsible for reaching out to these families and saying, hey, we are aware that this happened. We are here to provide you with education and resources and referrals if you're interested, and making those connections. And so law enforcement also gets that information. They oftentimes determine they're not going to investigate, and then they will say, okay, specialized care coordinator, you can contact that family, provide them with the resources they need. Okay. And so that was one bucket, is creating that referral process. The other bucket was training and education. We realized if we can create a referral system, but if we have nowhere to send these kids, what's the point? And what we learned in our data collection process was that we had very few providers who had training in working with youth who engage in problematic sexual behaviors. In fact, I think at the time we had 2 in the entire state, right? So we're creating this great referral process and we have nowhere to send these kids. And so what we immediately started to do, even before the framework was released, because we learned early on that there weren't providers, was to start to build up that referral base. So we started to bring evidence-based training into New Jersey and train our providers so we had places to refer these kids. And then we also, of course, had to provide community education to our stakeholders about how do we talk about these cases, how do we talk about these kids. We don't use certain language because we don't want to alienate children and families. We want them to voluntarily engage in services so that they can continue to grow and thrive, and other children aren't being harmed in the future. And so we have to make sure that we're using the correct language. The other piece was funding. Of course, as I mentioned earlier, we wanted to make sure that kids that families could access services without having to pay for those services. And so we secured funding to ensure that would happen. And then, of course, the quality assurance and oversight piece, making sure that what we're setting out to do is what we're actually doing, and we're able to take information to improve program delivery as we move forward.
Yeah. And I think that part of the framework, and I think this goes also to the language that we're using when we're talking about these cases. I have seen where we refer to actors and impacted child. But it's also about how do we support this family in a therapeutic way. I know that early on there was conversations about, does this live with the child protection and permanency, but there's no caregiver abuse because the caregivers might be acting entirely responsible. They're supporting their children. They're making the call. They just don't know where to go. Does it live with law enforcement? Well, it's not really, a law enforcement aspect to it. But how do we create an environment where it's welcoming, and it ensures that children get the support that they need, not just the impacted child, but also the actor in these incidents as well, right?
Absolutely, right. So we're not only, while we call it a problematic sexual behavior program, and we're concerned about the youth who engage in these problematic sexual behaviors, we also want to make sure that, yes, as you mentioned, that the child who's impacted is also accessing treatment. And so we've also built out that referral base as well. Those kids are involved. We refer them to trauma-focused cognitive behavioral therapy because they've experienced a trauma. And so those impacted youth are also being referred to services. And in fact, in our first year, we found that we're actually getting more referrals for those impacted youth than we are for the youth who are engaging in those problematic sexual behaviors.
Yeah. And I mean, even it goes to what we refer to this. You know, the term problematic sexual behavior came from that space of how do we talk about this in a way that, you know, previously was called child-on-child sexual assault. And we didn't want that to be what we're leaving families with. We want them to feel like they can come forward and seek out the services that they need. So problematic sexual behavior came from that dive into how do we talk about this differently. So I think that helps support that therapeutic environment. But how are we doing as far as building out that support structure? You mentioned there was 2 therapists that really had any experience with this. How are we doing building out that support structure in New Jersey?
Really well. And so in the first couple of years, we've increased our base by 100 times. So we have trained clinicians now trained in what's called problematic sexual behavior, cognitive behavioral therapy, PSB, CBT for short, which is the evidence-based treatment for youth who engage in problematic sexual behaviors. And so we trained 30 plus clinicians in working with adolescents. We are now in the midst of what's called a collaborative, where we're training clinicians in working with the school-aged youth. And so we have another 30 clinicians being trained in the school-age model. We've done 2 trainings for clinicians to work on what's called trauma-focused cognitive behavioral therapy for problematic sexual behaviors. So it's TFCBT for PSB. We've had 2 groups trained, and so we had 30 clinicians trained, and we're in the midst of training another group of 30 clinicians to be able to do that work with children as well. And then, of course, we're constantly building our referral base for trauma-focused cognitive behavioral therapy for the impacted youth as well. And so, I mean, we still have a lot more people to train. We still have, sort of these areas where there are shortages. We want to make sure that we're increasing access. And so we're going to continue to build on these referral bases over the foreseeable future.
Well, the good news is that we have identified an acronym, so it's official.
Yes, we have lots of acronyms.
DCF. Yeah.
Lots of acronyms.
I'm wondering if you can talk a little bit to what the data is telling us, either nationally or also like the number of referrals that we've gotten since we've launched this in 2024.
Yeah. So we don't know nationally for sure how common problematic sexual behaviors are, right? Because there is no one entity that collects that data. And so we just know what we know from various entities. So for example, the National Children's Alliance, which is the accrediting body for the country's 950 plus child advocacy centers, knows that about 25% of cases that come into our child advocacy centers involve a minor who is engaging in problematic sexual behaviors with another minor. We know that in New Jersey, we see the same is true. Our regional diagnostic and treatment centers that Greta mentioned earlier see our kids. They provide medical and mental health services to kids who come through our child advocacy centers and or are referred through child protection and permanency. They too were seeing that about 25% of their cases involved a child with sexual behavior problems initiating the behavior. And then in our CACs, we saw the same thing in our child advocacy centers. We also saw, that about, a quarter to a third of the cases involved another minor engaging in problematic sexual behaviors. So we knew it was pretty prevalent, and that aligns with the national data. Anywhere from 25% to about a third of cases involve a minor who is engaging in these problematic sexual behaviors. So we knew it was pretty prevalent, and we then decided to collect data in New Jersey to see what it looked like, right? So when the call came into the hotline, they weren't really tracking that information, right? There was no box that this involved at the time, child-on-child sexual abuse or activity. And so we created that box. And so then we knew when we were collecting all this data to see, you know, what it looks like and what kinds of numbers we're talking about with regard to referrals coming into this potential program, we found that about over 2,000 cases were being screened out that involved child-on-child sexual activity or abuse and what we now call problematic sexual behavior. And that's not counting the cases that were screened in, right, for child welfare services or a child protection response. So those are just the ones that were being screened out. So we knew we had at least about 2,000 cases that we were looking at that needed services that weren't currently getting access to services. Now, some of those cases, you know, if we look more closely, while they had some kind of allegation around, you know, a PSB, probably didn't meet those criteria, right? When you looked at it very loosely and just said, okay, it had 2 kids, you know, 2 minors, and there were sexual body parts involved, and so we coded as that. Maybe it was not, you know, going to meet the definition of PSB. And so in our first year, with those referrals coming in, we received over 1,100 referrals of those cases that were screened out into our program. So we started in March of 2024 and we looked through February of 2025, and that's what we saw, about 1,150 something cases that came through that were screened out.
Yeah, and it's 1,150 cases where services are being offered that they hadn't been previously able to access. So I think that's a fantastic thing.
Right, absolutely.
Yeah. I feel like we probably could have done 2 separate episodes because there's so much different things that both of you do that really speak to the continuum of safety. When I think about the work of how do we support children in the community, how do we support children in the home, these things that don't necessarily rise to caregiver abuse that would define, you know, what a typical involvement for a family would be through DCP&P, but they're so important to maintaining that sort of overall sense of safety, emotional safety, psychological safety, sexual safety. So I think that we really could have done two episodes, but I'm really thankful for both of you participating in this one. I'd like to, as we conclude, kind of turn it back to where we started, which was the Safety Subcommittee. And we talked a little bit about the policy work, we talked about the training work, but I'm wondering what's on the horizon? You know, what are we looking at next as part of the Safety Subcommittee that really defines it separately from what some of the things that we had done previously through the Task Force Protection Subcommittee, what they were looking at previously?
I think, as I said earlier, that I think what we're looking to do is just expand those child serving systems, looking at those other child serving systems. We're starting with schools right now, but then I think on the horizon is really how do we expand it to include the other child serving systems that are out there to make sure all of New Jersey's children are safe, healthy, and connected. Yeah,
absolutely. I mean, our goal really is to make sure that kids are safe from harm when they're in places where they are supposed to be protected by adults. But providing them with the tools that they need to make those places safe, because it's not, you know, we're sort of changing the norms around what our expectations are, both as adults who are responsible for kids, and also for kids to be aware of, you know, what they can do as well to keep themselves safe.
Well, I want to thank you both for all that you do, and you do so much, but around this continuum of safety, to really expand that, and to make sure that, you know, no child is left behind because there might be a gap in services or a gap in understanding as far as what safety means. I think you're both doing such fantastic work within New Jersey. I'm proud to call you colleagues. So thank you.
Thank you so much.
Thank you.
It's been nice being here.
So we talked today about this continuum of safety, and really how do we support children in their homes, in their community, and really want to thank our guests once again for joining us. Next time we'll talk about other aspects of our child welfare system, different ways that we're supporting families across the board, whether that's through safety, whether that's through prevention, whether that's through clinical intervention, through our children's system of care. It's all part of this really exciting transformation in child welfare in New Jersey, and we're happy to talk to you about it. So on behalf of my producers and the Office of Communications and Public Affairs at the Department of Children and Families, thank you for tuning in, and tune in next month for more DCF on the Air.